WHO e-learning caregiver skills training for families of children with developmental delays or disabilities. Introduction to the course. Welcome to the Caregiver Skills Training. This training course is designed to benefit caregivers of children with developmental delays or disabilities, particularly when there is a delay in communication and/or social interaction. However, your child does not need to have a diagnosis for you to participate. The skills and strategies in this course are designed to benefit children ages 2 to 9 years, although children slightly outside this age range may also benefit. Additionally, you can use the strategies in this course with all children, not just those with a developmental delay or disability. Ideally, caregivers who do this training interact with the child on a regular basis because children will benefit most when caregivers practice with them regularly. Course content. There are 15 modules in this course, and each will take around 20 to 30 minutes to complete. Modules 1 to 4 cover getting and keeping children engaged in everyday activities. Modules 5 and 6 are about helping children to share engagement in play and home routines. Shared engagement means that the child is noticing the adult and the shared activity at the same time. Shared engagement is best for learning. Modules 7 and 8 focus on understanding and promoting communication using words and gestures. Module 9 is about teaching new skills like dressing and hand washing in small steps and providing different levels of help. Modules 10 to 13 focus on understanding, preventing, and teaching alternatives to challenging behavior. Module 14 covers ongoing practice with your child and goal setting for the future. And Module 15 covers problem solving and caregiver self-care. How to use this course. We suggest that you start with Module 1 and complete the modules in order. This is because the skills build on each other. For example, the skills from Modules 1 to 4 on getting children engaged are important for Modules 10 to 13 on preventing and responding to challenging behavior. We suggest that you do one module every 4 to 5 days. This means that it will take you around 2.5 months to complete the whole course of 15 modules. Please consider planning a way to remind yourself to do the modules, such as setting a reminder on your telephone. Remember that it is important to practice the skills and strategies with your child regularly. Our approach to learning. In this course, you will learn by hearing stories and seeing pictures and short animated videos, learning skills and strategies you can use at home, which we call tips, doing activities at home with your child and practicing the tips from each module, using your journal to plan and review your home practice, and answering the Check Your Own Learning questions at the end of each module. Each module can be finished in around 20 to 30 minutes, but if you have less time, you can spend 10 to 15 minutes on the module and return to it later. How to use your journal. This course contains a number of journal exercises. These exercises will help you plan and practice the strategies at home with your child. The journal for the course can be printed for writing in or saved and completed electronically on your laptop or tablet. Download your journal from the Documents tab on the Open WHO course page. To complete your journal electronically, you may need to download free PDF software. You can find instructions for this in the first pages of the journal. Alternatively, it is fine to use your own paper journal and write down the questions, strategies, and suggestions, or use your smartphone to take notes or voice notes. Now, we will focus on the goals of this course for children and caregivers. All children with developmental disabilities and delays have their own unique strengths and challenges. The goals of this course are to help your child learn to use gestures and words to communicate, spend more time sharing engagement in activities and routines with you and others, show appropriate behavior more often with fewer challenging behaviors, and to learn new skills to be more independent in day-to-day activities. Your goals for your child. Before you start the course, we encourage you to set a few goals for your child that match your priorities. Examples of goals for your child include: learn to use gestures and words to communicate. Learn to communicate more often. Spend more time sharing activities with others. Show more positive behavior and fewer challenging behaviors. And become more independent in day-to-day activities. Please choose 3 goals for your child and write them in your journal. After each journal prompt, we will suggest that you pause the course to write in your journal and resume the course after you finish writing. Please pause the course here to write in your journal before continuing. Now, we will focus on the goals of this course for caregivers. The goals of this course are to help you feel more confident helping your child to communicate and learn new things. Connect with your child by enjoying and sharing daily activities. Learn how other caregivers have similar challenges. And to learn and practice more ways to support your own health and well-being. Your goals for yourself and your family. We also encourage you to set a few goals for yourself and your family. Examples of personal and family goals include: feel more confident using strategies to help your child communicate more and learn new things. Connect with your child by enjoying and sharing activities more often. Learn strategies to help your child show positive behavior more often. Learn strategies to help your child reduce challenging behaviors. Learn more about developmental disabilities and delays and the challenges that caregivers face. And learn and practice more ways to support your own health and well-being. Please choose 3 goals for yourself and your family. Please pause the course here to write in your journal before continuing. Getting ready to learn. For this course to help you and your child make progress on your goals, it is important that you practice the skills you learn with your child every day or almost every day. Even 5 minutes per day is useful when you and your child are doing activities together. The more you use the skills you've learned while sharing activities with your child, the better. Every opportunity you can find counts toward your goals. Practicing with your child can be hard work, so it is also important that you are taking care of yourself, your health, and your well-being as best you can. You may be experiencing difficult feelings, such as anger or sadness, or feeling alone. Remember that other families like yours have similar experiences. In Module 1, we will learn more ways to support our health and well-being as caregivers. After each module, you will be asked to continue to practice the self-care strategies you are already using or try something new before starting the next module. Throughout this course, you will find guidance that will help you work toward your goals. Now we will present some information that will help your understanding of developmental delays and disabilities. It is common for caregivers to blame themselves when they learn that their child has a developmental delay or disability. In the first few modules of this course, you will learn how to help your child engage in everyday activities. Learning new skills takes time, so it is important to know that your child's difficulties are not your fault and are not related to anything you have done, or to witchcraft, spirits, or other things. Sometimes caregivers blame themselves for not trying hard enough to teach their children. Developmental delays and disabilities are not caused by vaccines, spirit possession, hexes, or witchcraft, sins of the child's family or ancestors, single parents, caregivers, or guardians, allergies or food intolerances, caregivers who are not good enough, bad manners, bad education, family conflicts or trauma, distant relationships between parents, lack of limits or discipline, or lack of breastfeeding. Remember that caregivers can help children with developmental delays and disabilities learn. With support, all children can learn new skills. To finish the introduction, here is a summary of information about the course. Everyone taking this course has a child they are trying to help. This course focuses on helping children with communication, behavior, and skills for daily living. All children learn differently and at different speeds, and some children learn more slowly than others. However, all children can learn and develop skills. A doctor, nurse, or other healthcare or education worker who suggested that you take this course may have said that your child is developing or learning to communicate more slowly. They may have called this difficulty a delay, developmental disorder, condition, challenge, syndrome, disability, autism, or something else. Your child does not need to have a certain delay or disability to benefit. This course teaches you special skills to use at home with your child. All family members can develop these skills and practice them with the child. Engaging your child in everyday activities and games is a key strategy that will help your child develop and learn. And you will learn many different strategies in this course, but you will decide which ones work best for your child and your family. Thank you for completing the introduction. You are now ready to start the course. Remember, you do not need to finish a module all in one sitting, so please work through the course at your own pace. Take notes in your journal and complete the journal activities to get the most out of the course. And it is important to practice the skills regularly with your child. This is how you will help your child learn. Your effort, dedication, and daily practice are the keys to helping your child learn and develop. You are now ready to start Module 1. See you then.